Hello, and welcome to Chapter 10 in Electronic Health Records. We're talking about data management and analytics. Now, if you're following along in the book, we're on 267, and we have a graphic here talking about how big data is transforming healthcare. So, read through those 5 items there, and we're going to talk about big data as we continue through this chapter. So, over into the introduction, right below the learning objectives. Data is invaluable in every industry because data turns into information, and information is priceless if managed and analyzed appropriately. The healthcare industry is experiencing an enormous accumulation of data and information because of the EHR capturing this. Whether you're a medical assistant entering a patient's vitals, a physician entering assessments and diagnoses, a nurse scanning medication barcodes and documenting the results of medication administration, a lab tech entering information about a blood draw, or a coder entering a diagnosis and procedure, you are helping to build a repository of patients' health information within that EHR. So it doesn't matter where the information comes from. Again, it's talked about physicians or nurses or lab techs or coders. Information gets created by a lot of different people in healthcare, especially in the electronic health record. So let's talk about what makes up data and our data elements here. So data is defined as the descriptive or numeric attributes of one or more variables. Often the term data is referred to as a data element. So think about a data element being one single detail. Date of birth, patient's race, their ethnicity, a lab value, like let's just say a troponin score. Like that is one lab value, so that is a piece of data or a data element. So in Chapter 2, we learn that data is collected and analyzed to become information. To expand on this idea, data elements are combined into meaningful information about a specific group of patients. Data is stored in the EHR, personal health records, other databases and registries, and we'll talk about those later in this chapter. Let's talk about internal and external data. Internal data is going to come from your facility. It's coming from within your organization. So an example may be patient's financial information. Any information that your physician enters into the record, information that actually is originated in your facility. And then we have our external information, and that may come from outside, like CMS or from Hospital Compare. So Hospital Compare is part of CMS's quality initiative, and the goal of Hospital Compare is to provide data to examine how well a hospital delivers quality care and how healthcare organizations can improve. And so some of the things you might find in Hospital Compare is a readmission rate after a hip or a knee replacement by state. And so you can use that data to compare healthcare organizations, kind of like you did with your nursing home project in PI. You're able to go out and look at these different facilities on Hospital Compare, basically to determine, whether or not you want to go there to receive your health care. So that's an example of external data. All right, let's talk about data sources. So there's 2 kinds of data sources. You have your primary source and your secondary source, and you should be, getting glimpses of this coming back into your brain from health records. But primary sources is going to be the patient's information and their information coming from their record. So it's the information that's actually collected and put into their medical record. So that's, top of the line validity in our data, because it's either coming from the patient or it's coming from the healthcare provider that is, actually examining the patient. So it's original data found in the health record. Primary data may be used to document a patient visit and to bill the insurance. So again, it's coming from the medical record itself. Now, your secondary data sources, that's going to be data that's collected by someone else or data that already exists. And if you remember back from health records, some of our secondary data sources are our, indices and registries. So like your disease index or your operations index. You're pulling the information from a medical record and putting it into another database. Cancer registry, for example. That information came from somewhere, but it is not the actual information that was entered into the medical record. It's in a separate database. So you have primary sources and secondary sources. All right, let's keep going here. Over to page 270, talking about data integrity. Data integrity refers to the accuracy, completeness, and reliability of data in the EHR. The EHR includes data from multiple sources, including our primary and secondary sources. When data is generated by multiple sources, it increases the likelihood that errors will be present in the EHR. Data integrity can be compromised when the content of the data element is entered incorrectly, or when the EHR system protections do not work appropriately. So, example we have is a nurse does not enter a patient's medication allergy correctly in the EHR, which results in the alert not working because there's no allergy in the system, or it gets ignored. So that's just talking about whether or not it's accurate, complete, reliable. If the nurse doesn't enter that allergy information, is that chart actually complete? Is it accurate? And then again, like it said, it's not going to fire off those alerts because either it wasn't entered correctly or it wasn't entered at all. Now, what happens when that happens? When something's not entered correctly or it's not entered at all? Well, we may harm our patient. We may give them a medication that they're allergic to, and they could have, an adverse reaction to medication, and then we're doing more harm to our patient than good. So to prevent incorrect data, policies and procedures for data standards should be implemented. All right, moving over to 271, data standards. These are agreed upon definitions and formats of data. Interoperability is a key component to data standards. Data standards are important for bringing data into a common format to allow for sharing, which aids in patient care. Data standards help to create the exchange, transfer, and transmission of data between different systems. And so remember, data standards is almost similar to having that data dictionary. It kind of spells out how your data format should be. So let's just use the example of a date of birth. The data standard could be a 2-month or a 2-digit month, a 2-digit date, and then a 4-digit year. And so if that standard is across the board for your dates, then if another system has only a 2-digit year, that may not match up. So you would have to make sure that each system had the same standards for your date format. All right, so we just mentioned policies and procedures. Policies are principles or guidelines that are agreed upon by the organization. So policies are, let's use just being a staff member, for example. There are policies in regard to your attendance at work. So there's a policy for that. Or there's a policy for completion of medical records. Well, then there may be a procedure that goes along with that, and that's kind of going to be what you do to ensure that that policy is met. Almost how we talked about in PI, our goals and our objectives. So in this situation, policies may be similar to a goal. This is what we're going to do. This is what's going to happen or what should happen. And then the procedure is how you're going to go about meeting that goal or achieving that policy. So procedures are methods used to put policies in action within the healthcare organization. Together, policies and procedures provide an explanation to employees of the healthcare organization about how to handle data operations. Policies and procedures provide a framework to identify the data standards for a healthcare organization. Policies and procedures also detail the use of data, such as the policies and procedures of using data in relation to privacy and quality. Now, I mentioned Data Dictionary just a minute ago, and we've talked about Data Dictionary in several other courses, but this is our document that's going to describe the content, format, and structure of the data elements within a database. The Data Dictionary is important to data standards because it provides a way to prevent inconsistencies, define elements and their meanings, and also provide consistency and enforce those data standards. Common data elements that may be found in a data dictionary include the data field name, definition, the data type, format, field size, and the data values. And you can look at figure 10.1 at the bottom of 271 and get an example of what a data dictionary table looks like. All right, moving over to 272, going to get into, it's a little bit out of order. So data mapping. Talking about data mapping, this is a special type of dictionary. So data mapping is a method that is used to connect data from one system to another system. Data is analyzed in the original or source system to match data in the other or target system. So mapping the data is a key to accurate data connection. Data mapping can be matched through the data dictionary or data sets. Now, an example of data mapping is going to be when you're trying to map old ICD-9 codes to your new ICD-10 codes. So that's just an example of mapping. Now, you can map it backwards. You can map ICD-10 back to ICD-9 or the other way. But we have talked about mapping, I think, in probably health records and in computers and healthcare. All right, so let's talk about data collection. So we talked a little bit about this in Chapter 7, but data collection is important to capture and maintain the accuracy and completeness of data. It consists of both manual and automated data collection, and the collection of information can be shared to provide quality care to the patient. Manual data collection is data collected by a staff member or entered by the patient. Manual data collection can take place through a paper or a digital form completed by the employee or the patient. And our automated data collection is the reuse of data that was initially captured for other purposes. So we kind of talked about how when a patient comes in for a visit and we gather their demographic information or we gather their financial information such as their insurance and things like that. Well, we may not always get that information every time that patient comes back in. We may just verify what we already have. So that's what the automated data collection is it's kind of taking that information that we already had, such as name and address and date of birth and phone number and insurance information, and it's pulling it forward to another episode of care. All right, moving on to our data sets. This should also be familiar to you because we've talked about this as well. So data sets is a structured collection of related data elements. These data elements have standard definitions to provide consistent data for all users. And we have different data sets that are used across the different healthcare settings. So we have inpatient, which is our UHDDS. We have outpatient, which is our UACDS. And then we have long-term care with our MDS and our home health, which is going to be OASIS. So I'm not going to get extremely into detail with all of these, but be sure to read through each of these sections. So over on 273 and 274, and then over continuing on 275. And you have some examples here of core elements for the minimum data set, and then you have an example of the minimum data set, how you complete that. So again, be sure to read through those and just remember, which each of these goes with. So uniform hospital discharge data set, that's your inpatients. Uniform ambulatory care data set, of course, is your outpatients. Minimum data set is going to be our long-term care. And then our outcomes and assessment information set is for home health patients. So again, just brief yourself on those, make sure you know which is which, and then over on the OASIS piece, it actually shows some of the information that is collected. All right, moving over to page 276, we do talk about both of the ED type of data sets. We've talked about these before a little bit. I'm not sure that we got into great detail about these, but just know that there's two of those. We have DEEDS, the data elements for emergency department systems, which are uniform specifications for data entered into emergency department patient records. So we got 156 data elements there. And then if you drop down, you have the essential medical data set, and it complements DEEDS, and it provides data elements for the history of the emergency room patient, where DEEDS provides the data elements for the specific emergency department encountered by the patient. So they're kind of a complement to each other. All right, moving over to 277, talking about databases and indexes. So a database is a collection of data that is organized into rows, columns, and tables. And if you remember in computers and healthcare, you created a small database in Access. And indexes are a database that's used to find data without searching every row. The data is combined to form information that can be analyzed, managed, and updated. The EHR is a database that collects the healthcare organization and patient data. Healthcare organizations use data from databases to improve delivery and quality of care. Many types of databases are used by healthcare organizations. A few of the more frequently used databases are healthdata.gov, the Healthcare Cost and Utilization Project, which is HCUP, the Medicare Provider Analysis and Review, and the National Practitioner Data Bank. So let's talk about these. So healthdata.gov provides access to health data with the hope of improving healthcare quality. Healthcare data is collected from various sources such as CMS, the CDC, the FDA, and the National Institutes of Health. The database is used by innovators who are developing new applications and services that can improve the quality and delivery of healthcare. The goal of healthdata.gov is to permit private sector innovators to access data collected by the Department of Health and Human Services. All right, and then down at the bottom of 277, we have HCUP. This is a collection of databases that is sponsored by the AHRQ. This collection of databases contains data from state organizations, hospitals, private data organizations, and the federal government to create a national resource of encounter-level healthcare data. The database contains all payer encounter-level information back to 1988. It contains a variety of databases, including the National Inpatient Sample, the Kids Inpatient Database, the Nationwide Emergency Department Sample, the Nationwide Readmission Database, the State Inpatient Databases, State Ambulatory Surgery and Services Database, and the State Emergency Department Databases. This HCUP data is primarily used by researchers and policymakers. However, this data is publicly available. The collection of data is an information resource of patient-level healthcare data that is used to identify, track, and analyze trends in healthcare use, including access, quality, and outcomes. Then we have our Medicare Provider Analysis and Review, also known as MedPAR. And this is a database that contains inpatient hospital and skilled nursing facility records for Medicare beneficiaries. So this one is not quite as detailed because it's not going to include any patients that do not have Medicare coverage. Now, it does contain procedures, diagnosis, diagnostic-related groups, lengths of stay, beneficiary and Medicare payment amounts, and summarized revenue center charge amounts. The data is organized by state and then by DRG. The data fields include total charges, covered charges, Medicare reimbursement, total days, number of discharges, and average total days. This data set contains data on older patients since they're most likely Medicare patients. And then our last one is the National Practitioner Data Bank. We'll talk about this in PI as well, but this is a database that contains information on medical malpractice payments and actions against healthcare practitioners, providers, and suppliers. It was established in 1986 by Congress to deter practitioner fraud and abuse and promote healthcare quality. A user of this database must be authorized to access the data, so not just anybody can go out and get this information. You have to work at a healthcare facility or some other kind of company that would actually need or require access to this. So you or I can't just go out and get information. This data provides information on healthcare providers, including malpractice awards, loss of license, and exclusion from participation in Medicare and Medicaid. A healthcare organization accesses the MPDB prior to authorizing a healthcare provider to deliver care to patients. So if you have a new physician that is being hired into your facility and they're going through the credentialing process to make sure that their license is good and all of that, they're going to reach out to this National Practitioner Data Bank to make sure that their license hasn't been revoked or suspended, or that there's no malpractice suits against them. Basically, they're just making sure that the physician or other provider is just on the up and up, that there's not been serious issues or repeat offenses of something going on in that provider's past. So a healthcare organization, again, accesses that prior to bringing that provider on board. And then there's other users of this database that include professional societies, state and federal licensing and certification agencies. Healthcare providers may use this database to view their own information. So, whereas I can't access it, Dr. XYZ, he can go out and access his own information. All right, moving on to data warehouse. So this is a database that accesses data from multiple databases that are integrated to be used for analytic purposes. The data warehouse is viewed as the trusted source that brings together all of the data from the EHR and other data generators and gathers them within the organization. The data from the warehouse can provide information on a single patient or a related groups of patients. The goal of analyzing data from a data warehouse is to help healthcare practitioners and organizations provide better care. All right, and moving on to our data registries. We're going to skip the little section about data indices because it's really referencing back to chapter 8, and we're not covering chapter 8 in this text, of course. So moving over to 279 and data registries. So an EHR is used to collect various clinical and demographic data about each patient for every healthcare encounter. A registry is more specific as it is used to collect data about certain diseases or conditions. And our main one you can think of is a cancer registry, and then within a hospital also a trauma registry. So currently technology is being developed to integrate registries into the EHR. Meanwhile, registries provide valuable information regarding the health status of patients. And moving down to cancer registries, so of course this is a collection of data focused on cancer and tumor diseases. The data is collected by cancer registrars who collect information such as the patient's history, diagnosis, treatment, and status. And you should remember talking about that in health records. All right, clinicaltrials.gov is also a registry, and it is a registry that provides access to information on publicly and privately funded clinical trials. Clinical trials evaluate new lab findings that may advance diagnosis, treatment, or prevention in humans. And so these clinical trials are basically studies that use humans as their test subjects. You volunteer if you have a certain condition to try a new medicine, try a new therapy, and then they collect that information. All right, a trauma registry, which we mentioned just a minute ago, includes the collection, storage, and reporting of patient trauma data. Trauma data that is collected for the registry is based on seriously bodily injury. So an example of trauma is someone that was injured in a car accident and whether or not they were wearing their seatbelt. The registry collects data about an injured patient who meets specific criteria. The data consists of demographic, injury, and trauma outcome data. All right, moving over to information governance on page 280. So, one of the major challenges in the management of healthcare information is creating an effective framework for the access and use of healthcare data. This framework is known as information governance and includes the policies and procedures and processes for data and information creation, storage, access, use, analysis, archival, and deletion. Information governance is a relatively new concept in healthcare. It took the implementation of EHR systems for many healthcare executives to recognize the vast amount of data and information available to their organizations and the need for governance of this data and information. So, an effective information governance system should include the following components: a data governance committee, strategic plans for using and expanding data, management of quality data, appropriate access to data, and resources for users to correctly interpret the data. So let's talk about each one of these. So a data governance committee should be one of the first steps in establishing the data governance program. Should be made up of a broad representation of the organization's stakeholders. The broad representation promotes the establishment of processes, policies, and procedures that apply to the organization, avoiding those that are narrow in scope. For example, if only IT and HIM staff are on the governance committee, many clinical needs could be ignored. So you really got to make sure that you have a wide range of representatives from your organization on this committee. Second, strategic plans for using and expanding data. So a strategic plan is needed, and this is an organization's process of defining its direction by including goals or objectives and a sequence of steps to achieve each goal and objective. Then we have management of quality data, or data quality. So in the discussion of the importance of data quality, you learn how important it is for an organization to have accurate data. A successful data governance program should have specified auditing programs in place to ensure data accuracy. A key data auditing program that will be discussed in Chapter 11 is going to be our CDI programs, and we will get into that for sure. All right, let's talk about appropriate access to data. There's a need for data security as well as a process of minimum use in which each user of the organization's data has access to only the minimum amount of data necessary for completion of his or her job. Considering the heightened focus on security, there is a tendency to keep a tight control on all data. However, a well-functioning data governance program should encourage the use of data while keeping security protocols in mind. To facilitate the appropriate access to data, an organization should consider merging committees dealing with IT, privacy, security, and data governance. All right, our last one, resources for users to correctly interpret data. So, data users must have the necessary resources to correctly interpret the data. Otherwise, poor decisions could result. For example, the concept of the data dictionary is a perfect example of a necessary resource. The CEO of a hospital asked the director of radiology to provide the actual cost of a chest X-ray performed at the hospital over the past year. The director of radiology queries the database, requesting the number of chest X-rays performed on the admissions for the past year, and one of the numbers is needed in his calculation. By requesting data based on admissions, the director of radiology is missing the number of chest X-rays performed during the year on outpatients. The presence of the data dictionary would assist the director in accurately interpreting his data. So if all he's doing is asking the number of X-rays performed on admissions, well, our admissions are our inpatients. So yes, he is missing a whole bunch of outpatient X-rays that would have helped him in his calculation. All right, so moving on to the AHIMA Information Governance Principles. It's not going to hurt you at all to know these 8 things, so be familiar with these. But according to AHIMA, the foundation of data and information governance is accomplished with the implementation of these 8 key principles. So first, accountability. This is the designation or identification of a senior member of leadership responsible for the development and oversight of the information governance program. Then we have transparency. Documentation of processes and activities related to how information governance are visible and readily available for review by stakeholders. 3 is integrity. Systems evidence trustworthiness in the authentication, timeliness, accuracy, and completion of information. Number 4, protection. Program protects private and confidential information from loss, breach, and corruption. Number 5, compliance. Program ensures compliance with local, state, and federal regulations, accrediting agency standards, and healthcare organizations' policies and procedures and ethical practices. Number 6, availability. Structure and accessibility of data allows for timely and efficient retrieval by authorized personnel. And then number 7 is retention. Lifespan of information is defined and regulated by a schedule in compliance with legal requirements and ethical considerations. And then number 8, disposition. The process ensures the legal and ethical disposition of information, including but not limited to record destruction and transfer. So you don't necessarily have to know the definition for your test, but it is good to know the definition just for your own self and then going forward studying for the RHIT exam. All right, so let's talk about data and decisions. So we've talked a great deal about information in this chapter, talking about the actual importance of data in healthcare. And so it's important for making decisions about patient care. It provides information about patients, which can help identify treatments to improve and create patient-centered quality care. And then analyzing a patient's data can also help identify warning signs of serious illnesses to provide treatment at an early stage, which again is also less expensive. If you start treating a disease, let's just talk about diabetes, for example. If you can manage diabetes and keep your patient from either, having extremely low blood sugar or extremely high blood sugar, you're going to prevent, a lot of complications that can come along with diabetes and cause more visits to the office or hospitalizations. So again, preventative maintenance just helps keep those healthcare costs down. And then other ways data influences decisions include helping to predict epidemics, like let's just say we had a flu epidemic, cure diseases, and then avoid preventable deaths. Now, big data. Big data is the large data sets that are analyzed to reveal trends and patterns. Healthcare decisions are being made based on big data. It's being used to learn as much as possible about the patient to pick up on early warning signs as early as possible. This approach can lead to earlier treatment and again decreased cost. Now, informatics is a growing and evolving multidisciplinary field that focuses on technology and information. Informatics is defined as the science of processing data for storage and retrieval. There are many subspecialties of informatics, including healthcare, pharmacy, public health, nursing, and biomedical research. The goal of informatics is to examine the data to serve as information to increase knowledge between individuals and groups. Healthcare informatics, specifically, is the study of managing health information. Healthcare informatics includes health systems such as electronic health records, data standards such as HL7, terminologies including SNOMED CT, and health data collected through personal digital devices. Healthcare informatics is used to evaluate the patient's data to improve the quality and delivery of healthcare. And so now we are moving on to our chapter summary. Be sure to read that in your book on page 285. We'll go through a brief summary in the slide here. Now, as healthcare providers enter patient data into the EHR, they're participating in the accumulation of vast amounts of data and information about patients, their health statuses, and treatments rendered. Data integrity in the EHR is vital for organizations to achieve their goals. It's important for healthcare organizations to establish policies and procedures for their employees to follow regarding data usage and operations. One of the major challenges in the management of healthcare information is information governance, which can be managed via committees, data audits, restricted access to data, and resources for correct interpretation of data. And big data can be used in healthcare today to reveal trends and patterns that may predict epidemics and avoid preventable deaths. So as part of this chapter over on 286, you have quite a few acronyms and initialisms. It is not going to hurt you at all to know what these stand for, especially when, again, it comes time to study for that RHIT exam. Just knowing what AHRQ is, knowing what CDC is, knowing what the acronyms for your data sets, the UACDS, the UHDDS, knowing what MedPAR is, your National Practitioner Data Bank, things like that. So can I be familiar again with all those acronyms and initialisms? And so I'm going to let you go here. Be sure again to read your whole chapter, refresh yourself on those data sets, and happy studying and happy reading.